Hello, and welcome to another episode of the Improved Healthcare Podcast. Today, our topic is addressing maternal health inequities, early intervention matters, and it works, with Veronda Durden. In January 2018, Veronda Durden joined Any Baby Can in the capacity of President and Chief Executive Officer. She brings a wealth of experience from a career built upon improving the lives of Texans through work with government agencies, nonprofit organizations, and the Texas Legislature. Veronda is a former commissioner of the Texas Department of Assistive and Rehabilitative Services, DARS, where she provided leadership for a statewide staff responsible for ensuring Texans with disabilities and children with developmental delays pursue independent and productive lives. This mission is directly aligned with Any Baby Can's and speaks directly to Veronda's heart. So without further ado, how are you today, Veronda?
Well, good afternoon, Richard, and thank you for inviting me to spend some time with you this afternoon.
Thank you. It's good to have you. If we could just start with just a little background about Any Baby Can, what is it? And you're in the Austin, Texas area, right?
Yeah, we serve Central Texas, and a little bit about Any Baby Can. For more than 41 years, Any Baby Can has partners with parents so children can reach their full potential. We like to say that our programs meet clients where they are, at home, work, or school, and we provide telehealth and in-home therapy, parent education, mental health counseling, medical case management, resource navigation, and other family support services. We have a mission to partner with families to build stability, develop skills, and unlock each child's full potentials. And we are working towards a community that empowers parents, that prioritizes healthy families, and invests in child development. And as you mentioned, we are based in Austin, Texas. Mm-hmm. And as our community continues to grow and expand, we have also expanded to serve more families. And we are now providing services in 10 counties.
I used to live in Austin. It's a great area. A lot of very passionate people that are trying to help others. And so it's a model for the country. So one of the things I noted is that one of the foci is early intervention. So what is that and why does that matter?
Well, what we have learned is that an intervention is likely to be more effective when it's provided earlier rather than later. And this past Sunday, we celebrated Mother's Day. And so I thought it quite fitting to talk about maternal health and the importance of early intervention for better birth and health outcomes for moms of color and their babies. So let me tell you a little bit about Jewel.
Okay.
When Jewel found out that she was pregnant, she wasn't expecting it. In fact, she didn't even think it was possible. This was because of her medical history. Doctors had told her that it was highly unlikely that she would be able to conceive. Mm-hmm. She was 21 years old. She just finished her associate's degree, and she was working 3 jobs.
Wow.
After an accident at work, her mom and grandmother took her to the doctor, and that's when they found out she was pregnant and with twins.
Oh, my.
Now, Jewel has had several pre-existing conditions that placed her at a higher risk for pregnancy complications. But as soon as she heard those heartbeats, she knew that she would do everything she could to protect her baby. Mm-hmm. Unfortunately, though, as a young Black woman, Jewel would face an uphill battle against a system that historically excluded her and other people of color. And even at her first doctor's appointment, they brought up an abortion. And she says that every time she saw a new specialist or a doctor, they kept bringing up abortion.
Wow.
Unfortunately, she miscarried one of her twins, and the doctors continued to place doubt in her mind about her body's ability to deliver a healthy child. And she said that because of my health, they made me feel like they were saying that my body wasn't good enough for my baby. But she felt that as long as she was strong, she would fight for her baby. And so Jewel found our Nurse Family Partnership Program, and she was connected with Eunice, one of our nurses. Mm-hmm. And it was only after a few weeks of having met Eunice that she went into preterm labor when her water broke at 18 weeks in her pregnancy. The doctors again brought up abortion. She refused it again. And, they just continued to worry her that they were just ignoring what she was telling her. Mm-hmm. But Jewel is a strong woman, and she wasn't hesitant to speak her mind and hold her ground. And she was able to stay on bed rest and monitor the health of her baby until her son was born. And she felt that having Eunice at her side as a nurse helped brought her a sense of continuity and personalized care. And she was better able to monitor the preeclampsia and stay healthy through the birth of her son. So the baby was born at 23 weeks gestation. His name was Jeffrey, and he did spend several weeks in the natal intensive care unit, but Jewel was actively involved in her son's care. That's Jewel's story.
Wow, that's so touching. My goodness. I mean, is the story like hers unique?
Well, in many ways, her story is unique. She's one of a kind, facing many obstacles that no one could have predicted. However, her story is also indicative of what many of our clients go through, what many Black mothers go through to receive services. And of course, nobody, regardless of their race, should have to go through what Jewel went through. But the bottom line is that there are many women like Jewel out there. And I believe that a healthy pregnancy is a good indicator of success for the health and well-being and the future education of the child. And that's generally not the story for many women of color.
Well, this may go without saying, but I mean, does race matter?
Unfortunately, yes. Many women of color don't have the opportunity to speak up for themselves. And even if they do, they aren't heard. Black women are at a higher risk for pregnancy complications, preterm labor, low birth weight babies, and maternal mortality. Let me give you some numbers. Maternal mortality or death is 3 times higher for African American women than the general population. And it's also higher for Hispanic women or Latina women. Preeclampsia, and that's a disorder that involves high blood pressure and swelling that, if go on untreated, could lead to seizure, stroke, and possibly death. Women of color are at a higher risk for preeclampsia. And even if you look at Texas moms have a higher percentage of babies born at low birth weight compared to the national average.
Wow.
So our numbers aren't good, and they're especially poor for women of color.
It's amazing. I mean, it follows a trend that we see these days. You know, we've heard a lot about maternal mental health, and so would you talk about that a little bit?
Well, about 70 to 80% of women experience what we call the baby blues. And then about 20% of women are clinically diagnosed as postpartum depression. And again, Black women in Central Texas have much higher rates of maternal depression when we consider them against other women, particularly white and Hispanic women. And there was a 2019 report by Texans Care for Children that reported that across Texas, drug overdose is a leading cause of death for women up to 1 year after childbirth, and suicide is the 5th leading cause of death. And so if mental health issues go untreated, they could affect bonding, parenting, child development. They can last for many months, and they actually have long-term consequences for the mom and for the baby.
Wow, these are sobering numbers. And so the great part, I guess, if there was a silver lining to this, is that Any Baby Can is there. And so what are some of the things that you all are doing around maternal mental health and maternal health to maybe impact some of these?
Well, Any Baby Can, we're actively working to improve the systems and policies that bring lasting change for the clients and the populations that we serve. And I want to lift up 2 programs. The first is our Nurse Family Partnership Program, and the second is No Estás Sola. So let's talk about the Nurse Family Partnership, or NFP as we refer to it. Our NFP program partners a specially trained registered nurse with a first-time high-risk and underserved mom-to-be early in the pregnancy, because early intervention matters. So we connect with the mom-to-be at the 28th week of pregnancy, and we continue to walk alongside that mom until the child turns 2 years old. And the nurses work with the mom to build their confidence, their network, and their health practices, and the goal is to improve family health outcomes. The Nurse Family Partnership Program is an evidence-based community health program, and it's been around for more than 40 years. And it really has impacted the health and lives of first-time moms and their babies, and especially those who are unfortunately living in poverty. There are about 22 Nurse Family Partnership programs across the state of Texas, and our program is one of the largest in Texas. I would add that our program is making a difference. Some of our results include improved pregnancy outcomes. 89% of our babies are born at full term. Improved child health and development by helping parents provide responsible, competent care. 92% of our mothers breastfeed, and 85% of our babies have received all of their immunizations at 24 months. And those are key indicators.
Great
And then
numbers.
55% of our clients over 18 were employed at 24 months. And so that's another exciting number when we talk about economic self-sufficiency and helping the families to develop a vision for their future. And then what's even more exciting, there's a return on our investment. For every dollar that we put into our NFP program, it results in $5.70 to the economy at large. So there's a return on our investment.
Wow, that's great.
And and then the second program is our No Estás Solo program, which means you're not alone.
Mm-hmm.
And it's a mental health counseling program, and it's available to all of our Any Baby Can clients and families. And our licensed therapists create a safe space for our clients to explore together with them life's challenges, and includes parenting, relationships, family dynamics, the major changes in life, self-esteem. Our therapists help our clients to address individual and family stresses, to help put them on a path for future success, to learn about community resources, to reduce some of the symptoms of mental disorders, and basically to foster resiliency and recovery.
Okay. Really, you're doing some great work to, and they're in the safety net helping mothers. I mean, we all benefit, I can tell you, from having strong mothers. And so that's really wonderful for the mother and the child. So who is eligible for the Nurse Family Partnership and No Estás Solo programs?
Good question. The Nurse Family Partnership Program is open to first-time pregnant moms. And again, it has to be before the 28th week of pregnancy, because we want to come alongside them early in the pregnancy.
Okay.
And they have to qualify for WIC or Medicaid. And then our No Estás Solo program is one of our wraparound services at Any Baby Can. And so that program is available to all our clients in all of our programs. And I also wanted to highlight that our No Estás Solo program has a maternal mental health group where we connect with moms in English and Spanish so they can work together as a group to address some of their challenges.
That's very nice. Well, when you think about, I think you're a not-for-profit. So when you think about the program, the Nurse Family Partnership, who funds those? Where does your funding originate to support those programs? Okay,
good question. Our two major funders, one is the Texas Department of Family and Protective Services through their Prevention and Early Intervention Division. And 90% of the moms are eligible for Medicaid. And then last year, we received a major grant from the United Health Foundation, and this is really exciting. Oh. It's a 3-year partnership that's going to focus specifically on improving pregnancy outcomes and decreasing preterm births, empowering mothers and their partners. And the goal is to, of course, create a better future for themselves and their babies. But we're focusing specifically on moms with preeclampsia. And one of the exciting things is that we're equipping these moms with blood pressure cuffs so they can self-monitor their blood pressure, understand when they need to connect with their nurse or their OBGYN to adjust changes in status. And then also we're doing some mental health interventions for moms in our NFP program. So those are our two major funding sources for our NFP program. And then our No Estás Solo program is funded through a grant from the St. David's Foundation. St. David is a major funder and partner in building a more resilient community here in Central Texas.
That's great. Now, as a side question, are people allowed to just donate to Any Baby Can themselves?
Oh, yeah, absolutely. So our website is anybabycan.org, and there's a way that you can support, and philanthropy is a big funder for us. So individuals, corporations, and folks interested in supporting our mission and the work that we do to strengthen families so that all children can succeed, we would absolutely love to hear from you.
Okay, that's great. Well, I know that the Texas Legislature is in session. This is May through the end of the month. Are there any initiatives that they have coming up that you think might impact maternal health?
Yeah, there's a couple of bills that I'm really hopeful will pass this legislative session. The first that would extend Medicaid 12 months postpartum for moms. I mentioned that a lot of things happen after the mom has delivered the baby, and so extending Medicaid 12 months postpartum would support those moms. And then also There's funding that would support home visiting. A Nurse Family Partnership Program is a home visiting program funded through the Department of Family and Protective Services. And so I'm hopeful that they put more money into that program so we have the opportunity to impact more moms and ensure that we have a healthier community. I'm a firm believer that healthy moms equal healthy babies, equal healthy families, equal healthier communities. And so we're striving to make that so.
I agree with you. I mean, my mother knows this, and I know she listens to this podcast, but she knows how much I appreciate her for putting up with bad old me when I came through. And really, she was the glue for the family. So, to get ready to wrap up here, are there any updates on Jewel? I mean, now how long ago was that she delivered, and any updates on her?
Yeah, I'm proud to report that Jewel is now an advocate for new moms. She's awesome. Part of a breastfeeding support group, and she's helped other moms who have babies in the NICU by sharing her story and providing advice. And she has big dreams for her son Jeffrey and for herself. And she began an online bachelor's program in forensic science. And she has a goal to work for the FBI. So I say, go, Jewel, be the best that you can be. Keep reaching for the stars.
That is really awesome and such a powerful, positive story. And, I want to just thank you, Veronda. I mean, the work that from the time that I was in Austin and even now, I know that Any Baby Can has a magnificent mission. And I certainly appreciate, you spending time today to talk to me about it and let our listeners know about, some of the stats around maternal health and the things that you do. I mean, you are making a difference, and I know you know that, but thank you. And I'm sure the people in Austin and across Texas appreciate the work that you're doing.
Well, thank you for the opportunity to share just a little bit of a snapshot of what we're doing to make a difference in our community that's going to impact generations to come.
Certainly will. Thank you for stopping by, and I'll be talking to you soon.
All right.
All right. Bye-bye.